It's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we're going to cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. We're going to go into the briefing room now, where Yoon Tae-oh, Director General of Public Health Policy, will be sharing the latest figures and updates on the COVID-19 situation in Korea. And he'll be telling us about the latest number of infection cases in the country, especially with the spurt of sudden cluster infections here in the nation as well. And he will be also updating us on the efforts by authorities to contain the virus and address what many see as a second wave of infections in the country. Now, as you can see, he has taken to the podium and it looks like the briefing's just about to begin.
Let us now begin our regular briefing for June 22nd, one day. As of today, midnight, we have 11 new local infections and 6 new imported cases, and a total of 17 new cases have arrived today. And as of today, midnight, the total number of confirmed cases now stands at 12,438, and a total of 1,277 people are in quarantine undergoing treatment. We had no additional fatalities, and the death toll stands at 280. This morning, KCC held a meeting presided over by Health Minister Bang Neung-hu, and we discussed many agendas with the 17 local municipalities, including the quarantine measures in the metropolitan area, as well as measures to alleviate fatigue among medical practitioners in this summer. And he said that with the cluster infections also continuing to non-metropolitan areas, including Daejeon, Sejong, and Jeonbuk and Gwangju, he said that it is very important that we take preemptive measures. And he also said under the scorching heat, many medical practitioners are having more difficulties. And he said that we need to delicately take care of these medical practitioners who are fighting on the front lines. During the past 2 weeks, we have seen continued cluster infections, and this also has spread to non-metropolitan area. And we are also seeing new imported cases centering around the Asian countries. And yesterday we had 17 new cases. However, we have seen a decrease in the number of diagnosis testings during the weekend, and we believe that we need to monitor the trend going forward. Here are some updates on the Chungnam region's efforts, and these municipalities are currently exerting their full efforts to contain the virus. And they are also containing massive epidemiological investigation and diagnostic testings. And they have also carried out administrative bans on a lot of the high-risk facilities, including coin singing rooms and so forth. And it has also looked into the 2,400 restaurants that are installed in the construction site, and also 17 locations where the senior citizens live on their own, and these have been massively these inspections on these facilities have been conducted. And in Gyeonggi-do province as well, we have conducted similar inspection and crackdown also, and we also identified rooms for improvement, including the quarantine measures like wearing a face mask. And in Daejeon, the city, it has also continued to carry out inspections on its multi-use facilities, and it has temporarily shut down all of its public-run multi-use facilities, including libraries and so forth. And starting from today to the 15th of July, we have also conducted our intensified quarantine measures to hundreds of non-registered door-to-door sales business establishments. And nationwide, we also have witnessed about 20,000 religious facilities as well as other multi-use facilities have been inspected as well, and we have conducted nightlife establishments as well, and we also put in place numerous administrative orders as well. And the central government is also exerting our full efforts. The HQ here at the Welfare Ministry, we are also looking into the hospitals as well as the quarantine measures in the many metropolitan areas, and we also have conducted our inspections for the high risk, for the large scale academies and buffet restaurants. And these 4 facilities have been newly included as high risk facilities, and we are also including our and expanding our life treatment centers as well as other networks for medical treatment. And also we are going to transfer all of the patients who are hospitalized if they have less symptoms. And we are also putting in place a joint scheme to share the medical experts as well as equipment. And the Education Ministry also has conducted a wide range of testings for its students and faculty members. And a total of 12 schools nationwide have halted their resumption of offline classes. And the Defense Ministry is also carrying in its efforts. And as of now, about 500 soldiers are mobilized to each part of the nation to help curb the virus. And in Labor Ministry, they are also looking into high-risk facilities, and they are also putting in a crackdown on the clustered business establishments, including call centers, as well as meat processing facilities. And the police department is also putting in place toughened measures, and it is also carrying out about 500 investigations, and it has arrested 7 people who have breached the act on these infectious disease. And also the Communication Commission is also cooperating fully, and we are also putting in place the deletion of the personal information for the confirmed patients. And the firefighters are also have exerted their full efforts to transport about 50,000 people to the medical facilities, as well as about 380 people to the facilities among the foreign entrants. And the following are some of our measures to deal with the summer for the medical practitioners. First of all, as for the people who have been mobilized to work at the screening clinics, we will have flexible working hours to adjust to the scorching heat. And as for people who are working outdoors at the screening clinic, starting from the June 10th, we have put in place flexible working hours, and we are also providing them with support programs, including psychological consultations as well as physical restings. And also, if there is a concentrated hour of work, we will consult deeply with our related ministries to enable more mobilization of staff members. And in the summer, we will also provide more surgical gowns, and we have up to now supplied over 100,000 surgical gowns so far, and we will increase the supply going forward. And we also have distributed over 400 cooling vests so far, and we will also supply more of them going forward. And we also finished the setting up of ACs at screening facilities as well. And we have also announced toughened measures for the foreign entrants. And starting from 23rd, we will have stronger quarantine measures for people coming from Pakistan and Bangladesh. And as for those people coming in from Pakistan and Bangladesh, we will be restricting the issuance of visas for people aside from diplomatic or other business purposes, and we will also reduce the number of non-regular flights to these countries as well. And as for foreign laborers, we will confirm their area of self-quarantine, and we will also ban these people from entering entering the country if they do not have a place for shelter. And the South Korean government already knows at hand what is effective to curb the further virus. And in Chungnam region and Daejeon, we have also seen that many people have increase the transmissions of the virus at poorly ventilated places and crowded places without wearing face masks. And it is most crucial to refrain from going to these facilities that are crowded, confined, and close contact in environment. And we cannot even exacerbate the need for the wearing of face masks even in indoors when the ventilation is poorly done. And we also need to continue to exert our full efforts and participate in quarantine measures like wearing a face mask despite the scorching heat. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라주시기 바랍니다.
That was a live briefing from the South Korean health authorities updating us on the COVID-19 situation in the country. We just heard that there were 17 additional new confirmed cases, bringing the accumulated total to 12,438. There were no new deaths, however, meaning that the death toll stands at 280. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular newscast at midday Korea time. Bye for now.